I would also suggest that we would set up sports academy, that if a child or an adolescent fails academically, he can enhance himself through his talent and earn a living in a talent. And then too, we're also looking at Busoga as a region. We want to thank the Chabazinga that they have set up so many things to train a girl and a boy as far as adolescence is concerned, but still, it is still not enough. So
the causes of teenage pregnancies are many, but one of the key issues that seems to be coming out, which we've heard from the children and also from other stakeholders, is poverty. Poverty is a big issue because children need basic services, girls need pads, and because they can't get them, they are tempted to sleep with men who are able to provide for these small services. The other issue which is very important is the cultural practices and also how we bring up our children, the parenting. We do not talk about issues of sexuality. We do not empower these children to understand when they are right to how to understand their bodies, how to understand their needs, but also how to get services, to get help when they need it.
The decline that has come to about 13 to 15% as a district compared to the national percentage of 24. And for us as a project, we attribute these improvements mainly to the community level engagement, but also with the stakeholder engagement. Our biggest challenge as a district has been the issues of attitude change. But as a project, as the PSEA project, we want to appreciate that the back-to-back engagements and the multi-sectoral approach to these challenges has seen us come to this progress that the Assistant District Health Officer is reporting.
In Buyende and Ajumani, we've been able to bring down the rates of teenage pregnancies. We've seen Ajumani, I think last year we were able to bring them to about 13-14%. Buyende is still at 24%. That means there's a lot of work to be done. And the national average of teenage pregnancies in Uganda is 24%. So at least we've been able to bring it to the national average. There is still more work. 24% is a high. So we need to continue to work to ensure that we are bringing down the number of children that are getting pregnant every year. Yes, we work with young people, and the reality is that many of these young people are actually sexually active. Many of them have children, and some of them are even getting married at a young age. So yes, the issue of comprehensive sexuality education is very important. The issue of condoms, as a government policy, we do not talk about condoms in primary schools, even though we think that the need is there. So what is important for us is to continue working with stakeholders, to work with government to ensure that we understand the needs of young people, and to bring people together to ensure that even the religious leaders can understand the need to be able to talk about comprehensive sexual education in schools.